this point, what I'd like you to remember is we've got evidence that CBT for an eating disorder can work. However, when you start getting into the opinion-based literature, CBT is often presented as this uncaring, unfeeling kind of approach. I'd argue that's completely off the beam, because I've worked with a lot of people with eating disorders, a lot of trainees, a lot of colleagues. They're the nicest bunch you could ever hope to meet, but they care about keeping people well, and they care about getting well. And so we have to be honest with our patients. Getting well is tough work, but it's well worth it. So that's a kind of broad thing to bear in mind here. So let me tell you about CBT in general, and then I'll come back to what we'd be doing in CBT for an eating disorder. Okay, now, first thing to say is CBT was set up to be a very transparent model of treatment, very focused on the here and now, unless you need the longer term perspective. So we don't look at unconscious worlds, we don't look at unachievable knowledge, etc. We're very clear about we want to see what's going on for that individual. And we share this with the patient at every step. So we have our hot cross bun, that diagram you can see there, where we stress to people that all within that big green environmental context, you've got cognitions, you've got emotions, you've got thoughts, you've got physiology, and they all tie together. And if you change one, the others will change. So, for example, if you stop eating, there'll be physiological consequences. You will start starving. You won't be able to think straight. Your emotions will start becoming more unstable, etc. And because your emotions are more unstable, you try to get your emotions more stable by trying to restrict, and that leads to more of the problem. The cognitions get even less and less flexible across time. In short, we use this kind of model to say, let's try to understand what's going on and why some of your behaviors, some of your emotions, your physiology can all have effects. It is absolutely critical in pretty much every disorder that we talk about the biological side. Sometimes you'll see people represent CBT as being about the cognitions, the emotions, the behaviors. That is pretty much a travesty of the real position. So remember the biology. And if there's one disorder where you need to remember the biology, it's going to be eating disorders. I was counting them the other day. I managed to find 8 different books and a couple of podcasts and a couple of other media, all of which had roughly the title of "It's Not About the Food." And my take on that is, generally speaking, probably at the time the eating disorder developed, it wasn't about food. It was about control. It was about perfections. It was about regaining some sense of self-esteem in a world that appears quite toxic sometimes. However, by the time the person gets to me as a clinician, you better believe it's about food. It's about food every inch of the way to get the person out again. And then it's about rebuilding the rest of life. So we have to always remember, do the basics first. I often see clinicians who think, well, if I talk to the patient or if I work on their body image to start with, they'll be happier. And the problem for many of our patients is that's a bit like saying to them, we want you to fight a battle, but you're going to do it with one arm tied behind your back. It's not fair, and our patients deserve better. So we always start with the basics before going on to the more complex stuff. It doesn't mean the complex stuff doesn't matter. It doesn't mean we're going to ignore it. But we want to make sure that we can do this right. The analogy I use quite commonly for this work is it's a bit like building a house. The thing I really want to see on my house is the roof goes up, because then that tells me the house is there. But if I try putting the roof up without the foundations, without the walls, that roof isn't going to stay up very long. So we start with the foundations, we work our way up, and then we do the roofing. A key thing with CBT, the behavioral elements are critical. It's the B in the middle of the CBT, cognitive behavioral therapy. And to be effective, cognitive behavioral therapy has to be doing rather than talking. In short, the stuff that is most effective in getting change is behavioral change. Because if I get the person to change, whether it's, say it's in depression, it might be behavioral activation. If it's in anxiety-based disorders, it might be exposure therapy. Either way round, I know full well that if I can get the behaviors to start changing, all the rest starts following. And I'll see changes in beliefs, in biology, in emotions, social function, quality of life, motivation, therapeutic alliance. They all follow from getting that behavioral change. And I'd love to say I'm making this up, but seriously, there is a huge amount of evidence about this out there. And it's real clear about this. We start with behavioral change. Sometimes people say, but surely you've got to have a good alliance to make the behavioral change happen in the first place, or you've got to work on motivation first. All the evidence says, no, it doesn't. It doesn't work that way around. The way I'm fond of putting it to my trainees is sometimes, people like you, people value you more if you help them start get better. So we start on helping people to make changes so they begin to trust us much earlier. But the change is more effective if it's early. Again, critical point across CBT in general, early change is what makes a difference. The best predictor of whether someone is going to recover is not how depressed were they at the beginning. It's not what trauma have they experienced. It's not have they got a personality disorder diagnosis as well. It's how much change they make in the first 4 to 6 sessions in terms of changing their eating behavior, starting to put weight on, etc. And this is something which is there throughout the anxiety and depression literature. Early behavioral change is what we're looking for. So if you or your family member are thinking, okay, well, we'll go in and we'll spend a few weeks just kind of getting to know each other, etc. Any good CBT therapist worth their salt is going to be saying,